But 20 years went by. It took a long time to get there, and that's 20 years less lifespan that I have. So like the my remaining lifespan has gotten shorter. So even though we're in a better place than we are now, we've gone from having zero regulatory approved aging interventions to zero regulatory approved aging interventions. And while it's um, I think you have to maybe have a little bit of naive optimism in order to have hope on something as uh, difficult as solving aging. But yeah, like it's hard to like look at a line that's 0 to 0 and then project it all of a sudden. It's just gonna go shoot up all of a sudden, right? Like we don't. Yeah, it's not clear to me that we're the rate. It's like we need to make progress faster, but the rate of acceleration may still be too slow. And I suspect that it currently still is for at least most people alive today from benefit. Maybe somebody born today has a very high probability of living to see these technologies mature, but at the current rate of progress, I think most living humans will not live to see that, and I think that's really unfortunate. I think I at least think it would be it's morally imperative to try to solve these things faster, so that more people could benefit.
For the past 20 years, Mark Hamalainen has worked tirelessly on humanity's most important challenge, solving aging and creating a world where we have the option to live indefinitely. And once upon a time, he was a researcher at SENS Research Foundation, and Aubrey de Grey, the famous biogerontologist and founder of SENS, has called Mark one of his protégés. Mark is also the former director of science at genome engineering company Synthego and former director of product development at OpenCures, an innovative health assessment clinic, among many other things. But even though with all this experience, he would be the first to tell you that we still have zero interventions for aging. So, for the past couple of years, he's been thinking long and hard about what is needed to change this depressing fact. And this led him and co creator Nathan Cheng to start the Longevity Biotech Fellowship and to construct the Longevity Acceleration Roadmap, which is described as a technical plan to solve aging. Mark, welcome to Levity. We've been looking forward to have you on as a guest.
Thanks, Peter and Patrick. It's great to be here, and thanks for the warm introduction. Um, yeah, I had, like you mentioned, I've been doing this for a little while. I've been into longevity since before it was cool, and it's exciting that there's more people that want to hear about it and learn about it. So I'm eager to answer your questions and hopefully provide the audience with some insights into the sort of the more ambitious ideas when it comes to life extension, because that's where I've focused my career efforts.
And all of these things that have led you to this moment started at an early age, I believe, because I read an old interview with you. I think it's 20 years old or something like that, where you said that you don't even remember your your first ideas about wanting to live for an indefinite amount of time, and that you didn't like the concept of death. Uh, I think your parents told you that, right?
Yeah, I mean, when you're a small child, you go through the phase of just asking lots of questions like, what is this? What is that? And I asked them about death, and my parents are not religious, and they have both have scientific educational backgrounds. And so they didn't ever answer a question that they didn't know the answer to. They would just say, we don't know. Or they would say, like, so when I asked them about death, they said, yeah, it's um, you get as you get older, your body starts to break down, and eventually you die. And after that, it seems like there's probably nothing after it. Some people have theories about various religious ideas, and you're welcome to take a look at what they say, but they didn't endorse any of those views. And so it was kind of like uh, I think, and this, I asked these questions. I don't actually remember asking these questions. My mom just told me that I asked them. And I guess I immediately thought that was terrible. And why would you want to? This is not a acceptable state of things. People shouldn't die, just disappear and never come back. And so, but then, you're a kid and you just are having fun, like making tree houses and playing. So I didn't think about it again until age 13, at least not in depth. But then I read the Mars Trilogy by Kim Stanley Robinson, and I think that gave me, it was like a utopian science fiction series, which I think anybody who hasn't read it should definitely check it out. It's quite amazing, but it's the story about the terraforming of Mars that starts around 2040 and last 250 years, and some of the main characters from the beginning of the book are still alive because we've developed treatments and solutions for aging over the course of time. It doesn't start, there's no magic pill. It's like a gradual process, and the book is very, I would say, well researched when it comes to the science in every aspect. And the characters in it were actually sort of role models, like they were inspirations for me. It's like, oh, that's the type of person I want to be. I want to work on these grand long-term projects, and I want to live to see their fruition. And so I just kind of decided then that that was the path I was going down.
And where did you grow up? When I hear Hamalainen, the your surname, I immediately think of Finland as a Swede.
Yeah,
So,
yeah.
what's your
It's
background?
my ancestry is mostly Finnish on both sides of my family, actually. Um, so I grew up in northern Ontario in Canada, and apparently the climate and vegetation and everything there is just very resembles Finland. It's very similar, and so a lot of Finnish people, I guess, when they moved to the degree that there was immigration of Finnish people to North America, a lot of them moved there because it's like what they're used to. There's lots of lakes. Everybody has saunas. You would feel at home immediately, basically, in terms of the landscape. And so, yeah, I've never actually been to Finland, although I've been to every other Scandinavian country. I guess technically it is the furthest away, maybe, but I definitely want to go and visit sometime.
Okay, so you read Kim Stanley Robinson's trilogy. What happened after that? Did you know by that point that this is what I'm going to dedicate my life to, or has this been an
Yep.
evolving process?
No,
Yeah, you
no,
knew.
pretty much right away I was excited. And I mean, there's a lot of other things I'm interested in, but uh, one human lifespan just didn't seem, one natural or whatever natural means, one of the current status quo human lifespans doesn't seem like enough to do all the things that I would want to do. I'm interested in architecture. I'm interested in creating virtual worlds. I'm interested in hiking and backcountry skiing and sailing. There's just too much to do. And but I decided like the logical first step would be to actually solve this aging problem so that I could do all the things I want to do and not just a few of them. And so I decided pretty much right then that I would focus on aging first. And so as a high school student, got subscriptions to Science, Nature, and the aging journals at the time that existed, and all the textbooks I could get my hands on, and skipped my classes in order to read these. And my teachers were fortunately um, very forgiving of this, and were like, "Well, he's in the library reading Nature. We can't. It's not like he's skipping school to do drugs or something." So they were okay with it.
But I've also read that this interest actually uh, made you realize that there was a guy called Aubrey de Grey, and I think a lot of us has when we get interested in this field, we come across Aubrey quite soon, right?
Yeah, this was in the 90s. So back then, all he had were a few sort of niche papers and a book on mitochondrial sort
Right.
of biology. And I didn't actually come across those immediately because they were like sort of not, something that you could easily find by searching back then. Um, but then he's put out the engineer's approach to anti-aging medicine, and that was the first one that I saw of his. And when I read it, I was like, oh, thank you. Finally, somebody's saying something ambitious and, like not just talking about like, small tweaks to nutrient sensing genes and invertebrates, which like was pretty obvious that that was not the way that we would extend human lifespan to me, even at the time. Um, and so he was the first person to say something that meshed with my ideas of like what we should be aspiring to. And so I just immediately emailed him and we started corresponding, and he ended up funding some research projects for me as an undergraduate student. I did some summer research projects with funding from the Methuselah Foundation at the time. SENS actually was the name of his idea, but the SENS org didn't exist at the time. It was a spin out of the Methuselah Foundation, which he was co-running with Dave Goebel.
Right. And was it your research interest back then? Was it in mitochondria?
The first project I worked on was actually on the lysosomal aspects of
Mm,
aging. Yeah, so looking for enzymes to enhance the ability of lysosomes to break down things that we currently aren't able to break down that accumulate with age. So that
right.
was one of his seven sort of ideas, and that was the first thing that I actually worked on. And I did end up working on the mitochondrial side of things for my PhD. Um, but I dropped out of that PhD actually because I spent 2 years discovering that I was trying to reproduce work that I wanted to build on, like from predecessors and from other labs. And I spent 2 years discovering that none of that work was reproducible. And so I got, understandably frustrated and thought that, like, I was like manually moving petri dishes of cells from one incubator to another place and like manually pipetting. And um, I just realized that that way of doing research was so slow and error prone that like we wouldn't solve this problem in my lifetime if we did things that way. I call it artisanal science. And I wanted to have so Aubrey had an engineer's mindset when it came to what we should do, but he didn't really have an engineer's mindset when it came to how we actually achieve it. And that
Right.
was where we sort of differed. And I dropped out of my PhD, which he was funding, sort of much to his chagrin at the time. Um, but looking back, I think we've talked about it, and he definitely agrees that it was the right decision. There's been a long series of people trying to solve those same problems I was working on, and it's 20 years later, and they still have basically no success. It's small incremental improvements, but like at a rate at which it's kind of irrelevant to our lifetimes.
This kind of brings us to the present. You also are, as we said before, the co-founder of the Longevity Biotech Fellowship, and uh, I don't know. I met you the first time back in January of this year when you held a retreat in outside Stockholm. It was freezing cold. And Patrick, was it the first time for you as well that you met Mark at the retreat?
No,
No, you
I
met
think
earlier.
we met earlier.
Possibly at
Um,
ARDD or another conference.
Perhaps Rhode Island. Were you
Hmm.
there?
Oh, yep, yep, yep.
Yeah.
For the Vitalism Congress.
Uh, you know, Aubrey had a lot of confidence in you when you were just a young, self-educated biologist kid. Like, how come?
Um, well, back then it was, there weren't many people interested in this. So I think my enthusiasm and sort of self drive, like I was kind of doing this anyways, with or without him. I think that was, and we just, got along, and like probably I was able to talk at a deep level on all the scientific literature. So probably, yeah, it was just like we just were able to talk about at a deep level about all of the different concepts. And so I guess that was probably why he decided to actually bring me on to work with me. But there was a number of other people at the same time that also got involved, and they've also mostly gone on to do some pretty exciting things. There was like sort of an early cohort of people who um, I'd say took it into their under their own sort of personal mission to like be leaders in this field. And at the time, Aubrey was really the only person saying ambitious things. So of course we nucleated around him.
And now you are bringing a new generation of cohorts into the field. So tell me about Longevity Biotech Fellowship and why you wanted to start that.
Yeah. So I guess there's like many different bottlenecks to progress on actually solving aging as a problem. Like where I'd say is pretty. I mean, one of the reasons why I think there's deserved skepticism of the field is that it's pretty clear that at the current rate of progress, this isn't a problem we're going to solve in any living person's lifetime. And so we need to alleviate these bottlenecks to progress and move much faster if we actually want people to benefit from these ideas. I think we have coherent things to say about what aging interventions would look like, but um, so there's a couple different bottlenecks. One is obviously funding. It would be great to see more funding for aging biology and aging research and aging intervention development. Um, Another is talent. So, like most of the brightest minds in the world are not working on this. They're working on optimizing click-through rates for websites or hedge funds or other things that are, I would say, arguably maybe not socially beneficial, but are very lucrative. And that's the problem. Like, there's not like a strong relationship between social benefit and how much something pays you. Um, but the interest in longevity is growing, and so the ability to get paid to work on it is growing, and the money flowing in is growing, um, arguably exponentially at this rate point. And so we could see that change um, to not be the bottleneck anymore at some point. Um, but then it's like, yeah, talent, actually getting people onboarded to work on this because it is a new concept. And it's not something you can study in school. There's nowhere you can go to have a PhD in solving aging. You can have a PhD in aging biology, perhaps, but um, if you're really thinking your goal is to solve aging entirely, that's like a pretty niche thing still. There's only a few thousand people in the world that I would say would be would say they're directly working on that, and so that needs to grow if we're going to actually achieve that goal. And so the Longevity Biotech Fellowship's mission is to increase the number of people working on those hard technology development problems, the things that we need, the capabilities that we need if we're going to actually make fast progress in our lifetimes.
Can you quantify that? How many people have you onboarded so far?
I think uh, so. We've been around for, well, the first I should say the LBF is the merger of two pre-existing programs. I ran a program called Longevity Summer Camp, which was in real life only. And Nathan Chang, my co-founder at the LBF, ran On Deck Longevity Biotech, which was an online only program. And we merged those two programs together, and we've had, I think, so we've had 7 cohorts total between the programs, 4 of them LBF, 2 ODLB, and 1 from my program, and a total of, I think, 600, close to 700 people now that have gone through our programs totally.
And since the total number of people working on this is so small, that's quite a number, right?
Yeah, I think so. And we've had, I think um, at least 2 dozen companies have started from our members, and very many other sort of academic projects and things. So yeah, I think we're having a pretty big impact. I think it's hard to quantify these social
Yeah.
things.
So you mentioned bottlenecks, and you mentioned funding and talent. There's also data. Can you talk more about that? Because you did this survey
Hmm.
with with different people from industry and startups and researchers, right? Can you talk about that survey and the bottlenecks you found there?
Yeah, so this was actually came out of the first summer camp that we did, the first cohort I did. And we have in our community what we call community projects. And so one of our community projects was to actually survey the professionals in the field, both industry, academic, and government, like all, and independents, to survey them on what their personal bottlenecks to progress are. We didn't want people to be hypothesizing about the higher level. What we wanted to do is say, what for you specifically is slowing you down, so then we could look at the sort of do the numbers and see like what are the sort of overall sort of what are the things that people need more of, or what's in their way. And the number one issue was access to data, actually. So people wanted more large databases, things like the protein data bank, which allowed for the AlphaFold to come into existence. But what they would like to see is aging data. So whether it's medical records or multiomics, and longitudinally and phenotypic data, like sort of all of this type of data on the biology of aging. People wanted more of that and for it to be public and free, because they thought that would be the number one thing that would increase the rate of progress.
Setting aside medical records, would I guess it's maybe harder to get access to than the other types of data. Why is it so hard? Why is it so, is it siloed? What, why is it so hard
Um,
to access
there,
multiomics data, for example?
well, it's expensive to generate, and so there's
Oh,
been
you
like,
okay? So you need to generate it as well.
yes, it's not access is one issue. I mean, but I think generating it and generating it in a standardized way. We basically just need more human genome project type efforts to generate large data sets and have them be publicly available. I mean, there certainly are siloed data sets out there, but they tend to be, I would say, probably mostly too small, to really, they don't match the scale of the problem, right? So like there are silo data sets that it would be helpful to make them available. It would be nice to, I mean, the UK Biobank is a good example of a, yeah, a data set that you can get access to, although it's like apparently it can take 2 years of paperwork and back and forth to get access. But if we had more things like that and it was more streamlined and easy, I think that would be very powerful. But a lot of it would be generating new, larger data sets where you can cross correlate from the same people, medical records, functional physiological testing, multiomics. Like if you're getting these things piecemeal from different people, from different time periods, from different parts of the world, it can be hard to actually integrate all that data in a meaningful way. And so I think large projects like the Human Genome Project are what we need. There's basically no government agency in the world that feels like it's their responsibility to do this. That's, I think, the problem.
And I guess the Human Genome Project, there was also a very clear goal that you could actually uh, sequence a person's whole genome. What would be the clear goal here?
I think there are, yeah, I think there is a goal that you could set. I think the Human Genome Project happened for two reasons. One, there was a clear goal, and then one, there was a clear threat, actually, which people were concerned that private companies might sequence the human genome and then patent it, and then sort of public researchers and academic researchers wouldn't have access. And that was widely viewed as, if that were to happen, it would be an utter disaster for the rate of progress in biomedical research, because if one company owns this IP, they're not going to be able to move as fast as the collective world's public and academic and other private companies having access to this, right? So when you grant intellectual property, the downside is that you're limiting access to just one person or company, and there's only so much one person or company can do. And so for something as so clearly critical to understanding biology as the human genome, it would be a disaster for that to be owned by one person or company. So that was the threat.
It's also very weird that it could be owned by
Yeah,
one
yeah.
person or
Well,
company.
that's another thing is that I mean, you could change the laws to say that, um, DNA sequences are discoveries, not inventions, which I think makes more sense. But like, the patent system definitely gets abused, I would say, and things that shouldn't be patentable often do get patented. And even if it is eventually overturned, it can take years or decades, right, to go through that process of court battles and things. And so the idea of preemptively just sequencing it and making it public, that would prevent anybody from owning it. So there was a threat as well as a clear goal. But to get back to your question about like what would we want for aging, um, you can lay out a bunch of sub goals. Like for instance, there's the Human Cell Atlas right now, which is the Chan Zuckerberg Foundation is funding. Um, and again, it's unfortunate that it's not government that's funding this stuff, but we are fortunate that Mark Zuckerberg and Priscilla Chan are very interested in biomedical research and improving human health, and I assume lifespan as well. They don't say that specifically, but I get the sense that they probably do care about that. Um, they are funding the stuff and making it publicly available because they have the means to do so, and they want to see progress, and they don't care about owning any of it, and so that's great. And I would be awesome if more people with their resources would contribute to these types of projects. But yeah, you could say like figuring out all of cell identity space. Learning is an important part of learning how to engineer and understand biology. But I guess the dream project would be an exhaustive characterization of everything that changes with age, because right now what we have is a lot of piecemeal studies. Like one lab will specialize in cardiomyocytes and another will specialize in like macrophage lysosomes, and like so there's very niche, and we have all these sort of like detailed views of these small niches, but we don't have any kind of overview of like what is all of aging. It's just a lot of piecemeal studies, and the hallmarks of aging is just many people would be familiar with the paper, The Hallmarks of Aging. It's not actually a theory of aging. It's just a categorization system for the existing literature, and they periodically update it to add more hallmarks of aging. It's like it's obvious that like we don't have a comprehensive understanding of everything that happens with age, and so just doing an exhaustive characterization of at a molecular, cellular, tissue, and functional organism level, what are all the things that change with age, and how is that affected by, for instance, genetic background, environment, behavior, and medicine. And that's a big project. It's bigger than the Human Genome Project.
Do you think that could be a simple, reductive kind of root explanation of aging that explains all these various phenomena, described
I
in hallmarks?
Well, the hallmarks, yeah, is just a categorization system. It
Yeah,
doesn't provide a theory of why any of this happens.
but do you think there is?
So yes and no. Like when people say that, they're often, I think there's a bit of wishful thinking that there's some underlying sort of um, cause and effect, linear cause and effects relationship, that you can find the root of it and then apply your efforts to that root cause, and that would be the way to affect aging. Um, I think it would be very convenient if that was true, but I don't think there's any reason to suspect that's the way it works. And like that would be, and that's sort of like a programmed aging view, as if there is some kind of program that you can just like modulate at the root level. And my best understanding of aging is that it's sort of everything that is not encoded in your genome. So your genome is the germline's. So the germline is immortal, right? Like the species is immortal in a sense, and the germline produces us, the somas, the somatic bodies, as a mechanism of propagating itself. And you can think of the genome as a generative algorithm that produces a soma, and the soma uh, is good enough to make a new to propagate the germline, and that's sort of what we are. And aging is all of the things that are sort of incomplete in a sense, like all the homeostatic pathways that are not stable over long periods of time. They accumulate defects, damage, deviations that cause you to drift away from homeostasis and health. And so it's sort of all the things that are not coded for rather than anything that is coded for. And so, and a lot of it is entropic and stochastic and random. There's literally like thousands of different chemical modifications that happen to your extracellular matrix and proteins, long-lived proteins in the cells. And so there's not like a one thing that you can do that will just like there's not one drug or one therapy that could affect all of those different things is the problem. So you have to be able to um, develop like a suite of tools and technologies to address them all. That's the, I mean, some people are very strong proponents of what's called the information theory of aging, where they think it's just cell identity is drifting, and that if you fix cell identity, all the other programs will go away. And that's a hypothesis. It's a claim that one can make, but there's no, I don't think there's any strong evidence to support that's all there is to it. I think
I see.
it
Is
would
it
be very convenient if that was
yeah?
so, but it doesn't seem logically very probable to me.
But
To,
Mark, you said, sorry, Patrick, you said that I mean it's everything that's not part of your genome, right?
Yeah,
That
it's all the
aging
side
is
effects of like every chemical reaction is not 99%, is like less than 100% efficient, right? So you accumulate these like byproducts, which Aubrey de Grey would call them damage. You can, there's different terminology. I think Peter Fedoshev, it's for anyone who hasn't watched the debate between Aubrey de Grey and Peter Fedoshev, I recommend that. They get into the sort of the weeds of like how you define the semantics around and the definitions of these things.
right. Because I just wanted to clarify, because when you said it, I immediately thought of the information theory of aging, or at least epigenetic changes, and that you would, if you would address those, you could go back to this pristine genome. But you're talking more about byproducts of cellular processes.
Yeah, so you can imagine resetting the epigenome, but why? I guess it's not clear why one would suspect that that would cause all the other damage to go away, that we don't have mechanisms to clear. Like if we had mechanisms to clear them, they wouldn't be accumulating in the first place. And a lot of the epigenetic changes that happen with age are actually responses to that accumulated damage. The cell is actually adapting to its changing environment, and the changing environment is the accumulation of these chemical byproducts and damages. And so yeah, I don't think we have a latent ability to clear all of that stuff that just needs to be activated. It doesn't seem like natural selection would have produced that. It doesn't, natural selection doesn't produce anything that doesn't have a strong benefit. There's this concept called genetic atrophy. Anything that is not necessary tends to mutate and become non-functional almost immediately. For instance, when primates gained the or started eating fruit, they basically lost the ability to make their own vitamin C, which most other animals can do, because there was
Yeah.
enough of it in their diet that a mutation occurred in the vitamin in a particular gene, and we couldn't make vitamin C anymore. But it didn't matter because it was in our diet. But that's what happens when something's not necessary. It pretty quickly just mutates and becomes non-functional, because natural selection requires a selective pressure in order to maintain a capability. And so that to me, like it just doesn't seem probable that we have latent abilities to like clear all forms of damage that just need to be activated. Because why would natural selection have created that and it's just sitting there unused?
Can I just ask about this, because this is so intriguing to me? because there have been some news about reprogramming just the last couple of weeks. I think the founder of Altos has said some things, and so on. And there are people very bullish on this idea that we should be able to partially reprogram cells to get them to a younger state again.
Mhm.
Would you say that your view of this is that it might be helpful to give us extra years, but it's not the complete solution? Is it? I
Yeah,
mean,
that's all I'm
it
arguing.
seems like a lot of smart people are very, very bullish on this, but
Mhm.
you're just saying that we can't rely on this solely.
Yeah, so I think it will be powerful. It'll have a lot of applications, and it likely will have health and life extension effects. But it's not a complete solution. It doesn't solve every aspect of aging. It's one part of aging, and there's other things that happen with aging that it seems unlikely that it would solve, and so it will be part of the suite of solutions. It'll be a piece of the puzzle, but it's not a holy grail. It's not like a magic bullet that solves all problems. But I am also bullish on it being um, uh, quite beneficial. It's just not a complete solution by itself.
I mean, if I'm not incorrect here, right? It has been successful for some blind mice, right?
Well, yeah, I mean so they damaged an optic nerve and used it to help the optic nerve regenerate. That was sort of like one of the exciting early results in the field by David Sinclair's lab. There's been other useful applications. There's a number of clinical trials ongoing for various disease conditions right now, and yeah, so it definitely clearly is powerful and will be useful. But it's to say that it's like a complete solution to aging, I think is naive or wishful thinking. Like there's no reason to suspect that it will magically solve all of the damage to the extracellular matrix that we're accumulating. Um,
If we took away the funding for the uh, epigenetic partial reprogramming startups, it would be quite dire, right, for the longevity field as a whole. What do you think about this? That type of intervention gets so much attention and so much funding, and some of the other important areas are almost completely forgotten about.
Yeah, I mean, for better or worse, humans are herd animals. We have social norms. We like to look at each other. What we pay a lot of attention to what other humans are doing and when we decide what we're going to work on. And so you get these sort of like there was, telomeres were like all the rage at one point, and then it was senescent cells, and then now it's reprogramming. I think of all of the sort of hype waves, as I might call them, reprogramming is probably the most likely to actually produce something that is effective, and so I'm bullish on it in that sense, and which would be very good, right? Because if there are reprogramming therapies, based therapies that get to market and are very powerful, um, but obviously like there's things that they're not addressing. I think that will actually invigorate the interest in funding these other projects as well. And I think there is a building wave for another important approach, which is called replacement. I think we're seeing like the early signs that there's a wave of interest coming in that as well. So the ideal scenario is that we are funding all of the different paths and technology to all the important science and technology pathways similarly to the level that reprogramming is getting right now. That would be if that was the case, I think we would be on track to quite significantly extend health and lifespan. But if we're only doing one of them, um, the problem with aging is because it's a lot of different things failing at about the same rate. Unless you address all of them, you might not actually see as much benefit as one might hope. Because people say like if you cured cancer, you'd only extend average lifespan by like a couple years, right? Because you would just live long enough to die of something else. And that's the problem with aging, that it's a lot of different things And so you actually have to have a strategy for each of them.
Can we put a pin in replacement?
Mm-hmm.
We are certainly going to go back to replacement, but I think maybe to frame the discussion around replacement, we talked about your survey, the bottlenecks for progress in research in aging biology, and then you also have made a roadmap, a technical plan to solve aging. Can you tell us about the background for that and what it consists of?
Yeah, so I guess the reason why we started working on it is that through running the Longevity Biotech Fellowship, we're onboarding people to this industry, and obviously one of the biggest question for people is what should I work on? And so we were presenting people with like a broad, we were bringing experts with different opinions in to mentor these newcomers, and so that they could get sort of a sample of all of the different things that people are interested in and working on. But we wanted to create a document and actually like eventually a course, potentially something that could even be taught at universities that would give like a sort of a coherent overview rather than just getting like a random sample of different people's opinions. Like, can we talk to all of the different people and pull together some kind of coherent overview of like what are all the different parts to this problem? And that was the reason why we started building the roadmap, the technical roadmap to solving aging, as we call it. And so we've part of the survey that we did included questions on this, and then we've also done about 60 one-on-one interviews with experts in the field, and a lot of those are. We are starting we have a podcast of our own, actually. Just a little plug there for the Longevity Acceleration podcast.
Oh
Uh,
yeah, you can plug it. I love
yeah,
it.
yeah. So
Everyone should
those,
listen to it.
yeah, so those will be public versions of interviews that we had done privately in the past. But we specifically made the survey anonymous, and the interviews that we did private, because we wanted people's unfiltered thoughts. Because often you say different things if you know it's going to be public versus if you know it's going to be private.
Right.
And for instance, like if you look at the distribution of resources towards different sort of therapeutic modalities, small molecules gets the disproportionately largest investment and talent allocation, even though if you ask the people in the industry, the people that are actually doing this work, they don't actually think small molecules will achieve much, versus they think genetic medicine and tissue engineering approaches are much more promising and could achieve a lot more, but those areas get less funding. Gene editing is getting more now. Tissue engineering is still lagging, I would say. But yeah, there's an almost inverse relationship between what the people in the field think would be effective and what you can get funded to work on. And that's largely due to the people who actually have funding being fairly conservative and slow to adjust. Like, I don't I don't think it's like really like a conscious desire to slow progress. It's more that, institutions change slowly, and we have large institutions that were built around the idea of drug development in the 20th century, and changing direction to be like, actually we should be, we've kind of squeezed most of the juice out of that approach, and we should be shifting resources towards genetic therapies and tissue engineering. It's just like it's trying to change the direction of the Titanic, right? It just takes it's not an easy, it's a big boat to steer. And so that's
Yeah.
why it's slow.
Can we use the other analogy as well there with bottlenecks? What are the big bottlenecks there to turn this around?
Yeah, um there's like comfort level. I think like when there's new approaches, you have to develop comfort with them. So like with gene therapy, there was some early successes in the 90s, but also some prominent failures. And so but now there's like thousands of gene therapies in clinical trial. And basically, once you get some success, once you get some traction, that's what people tend to be very skeptical until a new approach has like actual tangible successes and applications, which is unfortunate because obviously progress relies on trying things that are untested, right? Like you can't make progress without trying new things. Yet people prefer to fund things that are incremental improvements on things that work, and are reluctant to take chances on things that are novel. Yeah. But I think we drifted away from your question about the roadmap, um, which is, so that's under development right now. You can go to our website, the longbiofellowship.org, and the roadmap is pretty easy to find there. And we have what we call the outline of it, and we break it into three categories: biostasis, replacement, and bioengineering. And so the outline for the overview of those, like to sort of explain why those three and what are they, that's available right now. And then we'll be one at a time releasing the more detailed sort of elaboration of the details for each of those three categories. And the cryo one is actually going to be available next weekend online, and that one probably before you publish this podcast, so you'll be able to include it in the show notes. There'll be the cryo portion of our roadmap will be up, at least version one of it.
Yeah,
These
that's
are going to
great.
be living
Thank you
documents.
for reminding me. Yeah, and we'll try to have Emil Kensiara as well on the podcast soon.
Yeah,
I'm really looking forward to that.
yeah,
I
he
met
can
him
talk
at
in detail.
the.
Mhm.
He can certainly do that, and I met him at the retreat in Sweden, and it was actually quite funny because I didn't know who I was sitting next to. I just heard him talking something about tomorrow, and then I said, "Do you work at tomorrow?" And then,
The
yeah, I'm the
founder.
CEO. Yeah, the founder. And then we talked for several hours, and
Mm.
he's so extremely knowledgeable about that field. He knows
Mhm.
everything.
And they've just opened operations, and they're European based, but now they actually have opened operations in the United States, and Canada will be coming soon after.
Right, right. Yeah, it's exciting. Okay. Um, and and I mean, you do include small molecules in the roadmap, but it's like that's where we are today. It's not where we should go, right?
Yeah.
But then you also have, um, aside from biostasis, you have bioengineering, which is, I guess, what you would call partial cellular reprogramming. But you also go much deeper. You alluded to it before when you talked about like uh, things like full cell state capture and so on.
Yeah, so
Can you talk a little bit about that, the bioengineering side, and what do you see for that? I mean, it's one thing is that it seems to be extremely expensive to do.
Mhm. Yeah, so bioengineering is, so we have three categories again: bioengineering, biostasis, which includes cryostasis, but other things as well, and replacement, which we'll get into later. Um, Bioengineering is the idea that you can learn how to modify ourselves such that we uh, don't age anymore, by gaining engineering control of biology. The same way that you can renovate your house, you can renovate your body. I'm going to upgrade my kitchen. I'm going to upgrade my liver. So the and replace parts, right? Like we have engineering control over vehicles. Like if a part is starting to not work properly, we can replace it, and you can keep a car going indefinitely, and people do that. You could imagine doing that with biology as well. And so that's bioengineering. And reprogramming is a particular strategy within bioengineering, but it's far from the only one. So uh, if you like when we design, build, maintain cars, like we have computer models of how they work. We have a physics understanding of how combustion works. We basically have a sort of comprehensive understanding of how cars work and how to make them and how to make and keep them functioning. And we don't have that for biology yet, right? Like you could design a car in a computer aided design software and then have all the components manufactured and assemble them and have a pretty good chance of it working, or maybe you just have to make some minor tweaks because something isn't quite exactly as you predicted it in your computer model. But we have a pretty good, we can do that with cars. With biology, if you were to say make a genetic modification, we can't predict the results of that in silico yet. And so that in certain cases you can, in certain simple cases you can, and in microorganisms, like people have pretty advanced models of microorganisms and their metabolism and their genetics. But for something as complicated as a human, we don't have computer models of that yet. And so, if you really want to do the bioengineering pathway and eliminate aging by using genetic modifications and other interventions, whether they be transient expression of things or enzymes or proteins or cell therapies or drugs. And I want to correct you actually on one thing. We actually don't include small molecules in our um, roadmap because we decided to only include technology pathways that in their mature form could plausibly solve aging altogether. And we already know that small molecules can't do that. And so we actually
Right.
don't include them in the roadmap. We mentioned them just as like a sort of intermediate thing to maybe buy some extra health and time, but they have so many limitations, and even in the best case scenario the upside is small. So we don't actually include them in the roadmap. But you could think
Right.
of small molecules as the primitive form of bioengineering. It's like the sticks and stones versus the combustion engines and cars. Um, so within bioengineering, you need four major categories of things. You need to be able to collect data. So that's how you, like, in order to understand biology, you need to be able to collect a lot of data. You need to be able to build models of biology. That's the same way, with climate, right? We collect a lot of data on climate, then we build models of climate. They get iteratively better over time. So you need data models. You need to be able to design things. So you need design tools to like design interventions. So like, well, it's like, so what modifications do we want to make? We need to be able to design those, and then we need to be able to deliver them. So those are the sort of four major categories. And the delivery is, maybe it's a gene therapy, maybe it's a cell therapy, maybe it's a in the early cases, there's going to be maybe a few drugs, but we don't include those. And yeah, there's other modalities as well.
Yeah, I was going to ask you about there was a paper coming out recently where they've gone beyond CRISPR, so they can actually edit without making cuts in the DNA, and they can edit much larger chunks of DNA. And this was in bacteria, I believe. Um, so we don't know yet if it's going to work in mammals, but if it does, is I'm just thinking that isn't this some sort of breakthrough that we didn't foresee, and that might be able to do these kinds of things faster than we thought.
Well, like you said, it's for cells, not for organisms, right? So we actually have pretty robust, abundant, and diverse options for editing DNA um, when it's in cell culture. And but it's a totally different ballgame to try to do a gene therapy to a living person that has like 30 trillion-ish cells, right? So that's called the delivery problem. And actually getting those molecular tools, we call them, so like the different enzymes and elements, getting those to the cells in your body is actually the hard part, the unsolved part. We have, like, you can inject like liposomes, which or viruses, but they tend to have small payload capacity, and they don't evenly get to all of the cells in your body, right? Like, um, the liver is designed specifically to filter this kind of stuff out, and it usually is very effective at doing that. The topology of the inside of your body is complex, and so like some cells are, the endothelium is directly adjacent to the capillaries, but you want to get to the cells behind them, and sometimes a cell might be 7 cells away from the capillary, and so like the things that are closer are going to get maybe 1,000 times the dose of the things that are farther, and different tissues are going to have different unique challenges. And so getting getting those molecular tools to all of the cells in your body and doing so in an even manner is very important, because if, say, one cell gets a million times the dose of another cell, the probability of the cell that got the million times extra dose having negative side effects is very very high, right? And so you yeah, it's called the biodistribution problem, and that's one of multiple hard problems in delivery of these genetic modification tools. So yeah, just having the tools to make edits doesn't isn't there's multiple components to actually turning this into uh, therapies that could actually have a big impact.
I thought you wanted to say something, Patrick. It looked like you were going to.
Well, I don't want to sidetrack, but perhaps about not including the molecules. Is that in some sense to create awareness or correct a very common misunderstanding that when people get excited by molecules, they need to kind of calm down and understand what they can give us 5 to 10 extra years, but they're not going to address the real underlying problem, aging, which is so incredibly hard for people to see, even people who work in the sciences.
Yeah, I think for multiple reasons, it doesn't make sense for us to lend any more weight to the small molecule paradigm, right? For one thing, it's already a massive institutional sort of bias that gets most of the funding already, and so why would we try to direct more effort there? From a bang for your buck, like we're far into the diminishing returns. People talk about how trials have become so expensive, but a large portion of the reason for that is that we are in the diminishing returns, right? We found the low hanging fruit, and it's and going further down that pathway is just going to get everything that you try to find is going to be harder. You're going to have to screen more compounds. You're going to have more and more. The ratio of failure to success just keeps getting worse, right?
But Mark, can I push back on that a little bit? Just to ask you. I mean, it used to be quite a random process finding drugs that worked, and now there's all this talk about that we can screen so many more compounds. We can do it faster with the help of AI. But do you think that we're all already past that point of diminishing returns, even though we could have new tools to really test in a way that we never have been able to do before?
Yeah, those new tools will help us find what there is to be found. But even if we find everything there is to be found, it's just pretty clear that from a logical standpoint, it won't get you that far. And so and in building those tools is expensive too, and training people to use those tools is expensive. So why would we not be, if at least not be putting equal weight into developing new modalities that are there's a pretty strong consensus around would actually be more powerful and more effective. I'm not opposed to, finding all the things we can find within the small molecule modality, but I would probably want it to be on equal footing at the minimum with pathways that we know will be more effective. Right. So engineered cells and gene therapies and tissue engineering should be getting similar levels of funding each, right? Rather than just being a sort of an afterthought and a small marginal uh, portion.
Tell me about the way that you made a calculation for how much the bioengineering pathway was, how that was going to work.
Yeah. So one of the things we're doing with the roadmap is delineating sort of specific projects with cost and time estimates. And with replacement and cryo, there's a pretty strong set of plausible uh, work to do that could solve problems and actually get you to the point of being useful for humans. There are open science questions in both of those areas, which whenever there's an open science question, that means you can't actually assign a time and a number to something, right? Because it's reliant on discovery, and you don't know ahead of time how long that will take. So that would be like an indeterminate thing. But for biostasis and replacement, there's a pretty strong argument that they're more engineering problems where you just need to solve an engineering problem, design a solution, versus and there are fewer sort of open science questions that have been unresolved. When it comes to bioengineering, because in order to engineer a solution to aging through therapies, um, you would actually have to comprehensively address aging, and we don't actually know all of what aging is yet. And so you can't actually put a number on it. Like we don't know how long it'll take to find out what all of aging is. That's science. That's just the way science works. And so it's very hard to make any kind of cost estimate. Like, I mean, just talking to experts, they would say that if you sort of the numbers that we heard frequently were like if there was $1 trillion per year being spent on all of the sort of different aspects of bioengineering capability development and testing and translation, then maybe in like a couple decades we could solve aging if we were spending $1 trillion a year. We're obviously not spending that much. um, so so it's just, yeah, so but those are just like, napkin math. What we are going to, when we do come up with a more detailed section of the roadmap for bioengineering, what we'll do is lay out a bunch of capabilities that are intermediate steps that we think are critical to getting to solving aging, and we'll provide budgets and cost estimates for those. But we'll have to be clear that even if you achieve these things, then you're just at the point of testing them to see if they work, and you don't know for sure if they will. Then you might need to do another round of like technology development that we can't even foresee yet, because there's unknown unknowns when it comes to understanding and fixing aging using the bioengineering approach.
So let's say that we get artificial general intelligence in 10 years. How would that help with this tremendous effort with solving bioengineering, and what could it not change?
So I think it's a bit of a wild card, but I prefer to think of it as we're going down this path of developing computational tools. So like a true AGI that's like a mind that is like sort of human level or greater, potentially much greater. Certainly, that's fun to think about from a science fiction perspective. I don't think we know how far away we are from that. I used Chat GPT, and it's definitely not that. It's actually not very useful in um, sort of more niche science applications yet. It doesn't really understand those things because there's not enough training data. Um, and yeah, but I think that, for instance, I told you about how the reproduction crisis, like how I was unable to reproduce a predecessor's results. I think bringing computational tools and automation into biology research is essential in order to make progress at the speeds that matter to us, so that we'll benefit in our lifetimes. And you can do things like closed loop, fully automated research cycles where you're trying to solve a particular problem in biology already, right? So companies like New Limit, BitBio, they're searching the space of transcription factors for how you can use them to control cell identity and turn one cell into another cell, or reprogram a cell into a healthier state and maintain it there. And those types of um, exploration of solution of biological space, um, following algorithms and informed by AI, are very powerful, and that's the way we should be doing biology research. So I just think that I think it's very exciting that computational tools and artificial intelligence are getting better. And I think anybody who wants to make progress in this field should be either using or developing the latest tools in that regard. And if you're not, probably when we look back in history, you're probably not doing something that mattered, right? Like you could have just not done what you did, and it didn't actually affect the sort of trajectory of history when it comes to our capabilities with regard to solving aging. And so in the LBF, we encourage and push people towards using those sort of modern tools if they're going to go into biotech. because yeah, the old way of what I call doing artisanal science is very slow and very error prone. It does still have a very important role though, which is in discovery. When you're doing very new things or unusual things, it doesn't make sense to automate those immediately. So it's kind of exploring at the edges of different developing new methods, looking at new species. Those are still usually done by hand at this point, and that's important. But we need a lot more people to be doing the more automated computational approaches. Like, for instance, people talk about how CRISPR was like a cool discovery, right? And that's like a sort of a product of that sort of more artisanal approach to science. People were just studying how do bacteria defend against bacteriophages, and they were using these sort of esoteric methods and finding proteins, identifying the proteins involved, and getting crystal structures of them, and like characterizing them. Um, but more recently, there was a different paper that I could probably look up for you if you want to include in the show notes, where people just did like a broad screen looking for any enzyme from bacteria that interacted with DNA. So they had no hypothesis about how it did it or what it did. They were just looking for, they were just doing a broad empirical undirected screen for anything that affected DNA. And of course, CRISPR is one of the proteins that you would find if you did that. And so uh, I think the artisanal approach to science can be overrated, because I think you actually can make these discoveries using a more empirical brute force, just characterize everything, screen everything, use automation and computational tools to narrow the search space. You actually can make those kind of discoveries using that approach, that more modern approach. And I would like to see more dollars put towards that way of doing things. But again, there's institutional inertia there, because right, there's tenured professors that are used to doing it in this more old-fashioned way, and it actually, ironically, I want to extend lifespan, but sometimes it takes people retiring and new people coming in for these things to change.
Right. Did you want to add anything on AI and computational tools, Patrick?
No, I mean, just perhaps do you think it's a big bottleneck right now with the tools and the, just let's say, the instruments as well?
Yeah, I think more training programs for people to learn how to use those tools and to stay up to date with them. It's really hard to keep track right now. Even people whose full-time job it is to keep track of that struggle. And so I think we actually need training programs for scientists, because they're busy doing their own research. They don't have time to like read all of the AI and automation literature and keep track of that. So I think, yeah, there's an important role for training there, and I think that's something that is maybe just underappreciated at a societal level, is ongoing training when you're an adult and you have a career, right? Like, once you have a career, the pressure is to get results. But I think we should be spending at least 1 year out of every 4 focused on training and learning. I think that we would have a much more productive society in every way if, like, instead of like, you go to school for 4 to 8 years of undergraduate and grad school, and then you just have a career and you don't learn anymore, except when you can squeeze it into your free time. I think if we, like, one out of every 4 years was going back to school or self-learning of some sort, that would actually that would cause us to make more progress on every problem that humanity faces.
Yeah, I
It
guess
would
the
be it would be
LBF
a
is,
very clear
yeah,
cost benefit for any country to enable that.
yeah, I guess the LBF is creating or promoting this kind of awareness of what other paradigms are up to and spreading
Yeah,
that
and
as
of
well.
course, if we extend lifespan, of course we would want, like, and that would include, like, improving brain health so that your brain stays healthy and dynamic as you age. I mean, of course, you would want to go back and study new things and change careers multiple times, right? Like, if we live to 150 years or longer, you wouldn't just have the same job for that whole time. That's insane.
Okay. Should we maybe now, we've talked about bioengineering, and we talked a little bit about biostasis. We talked some about small molecules, which is not included in the technical plan. But of course, the big thing for me when I was at the retreat was that you talked about something called the replacement strategy. What is that?
Yeah, so that's the general idea of just replacing old parts with young, the same way you would do for a car. Aubrey de Grey makes this analogy in SENS, how you can keep a car going, but he's usually talking about repairing damage at the molecular level. But that's not actually what you do with a car. You don't like inject some kind of uh, thing into the engine to try to repair the rust, or like if a part wears out, you actually just replace the entire part. And um, that's something that you could do for biology as well. People get new organs sometimes now, right? If they have a kidney that's failing, or a heart that's failing, or a piece of a valve that's failing, like they get a transplant. And so we already do this in the context of diseases. We don't do it in the context of aging, but for instance, somebody who gets a kidney from somebody younger than them versus somebody who gets a kidney from somebody older than them. If you get a kidney from somebody younger than you, the outcomes are better. And it's not surprising, right? Because it's a younger kidney, it's healthier. And you can even you could potentially imagine growing brand new, fresh, like sort of like teenager healthy level organs and using those for transplant, and having that be the default. Um, but you can take this even further. Like if the advantage of this approach is that you don't actually have to understand aging at all in order for it to work, right? Like when a new person is born, a new organ is grown, it is young. And so you don't have to understand aging to know that replacing an old organ with a young organ has reversed aging. Um, and you could scale this all the way up to full body replacement, where instead of doing 20 different surgeries for different parts of your body, just do all at once. Just say you're a 65, your body's not nearly as good as it was when it was 20. How about a brand new one? By definition, it would be young, and so you wouldn't need any drugs, you wouldn't need any gene therapies. You would just do a body transplant and get a fresh young body. And you can do for the head. So obviously, I mean, the reason why I mentioned body transplantation is that the brain is your identity, right? It's your personality. Not all of your nervous system is in your brain, but most of what we consider the identity carrying portion of your nervous system is in your brain. That's where the memories are stored, and higher cognitive functions are performed. And so you could imagine doing um, everything except the brain potentially replacing. And then even when you come to the brain actually shrinks with age. It sort of atrophies. And so you could imagine adding fresh young tissue to the brain and allowing it to incorporate that, and doing that on some maybe once a decade to help keep the brain rejuvenated. So there's a lot of research in the brain is probably the most challenging part. But yeah, just by replacing old tissue with young tissue repeatedly over time, you could imagine sort of keeping the body going the same way that you can keep a car going. There's major open hard engineering and science problems there, though, like for instance nerve reconnection. But there's also a lot of promising progress on those areas as well.
Do you see that there is a cultural problem as well with the idea that you would replace and maybe grow whole non-sentient bodies? I mean, there used to be um, problems with the idea that we could transplant organs. It's not anymore. Do you think that this will go the same way if it works?
Yeah, I mean, whenever something is new, there's sort of a reflexive. I think like human psychology has a bit of a status quo bias and new things are where you tend to be a little bit afraid of or a little bit weirded out by. But yeah, organ transplant, I don't think anybody is weirded out by the idea of a kidney transplant anymore, right? And nobody seems to be bothered by the idea of growing an organ on its own, um, or 3D printing an organ or whatever. I don't think I've ever come across somebody who finds that sort of objectionable. The idea of growing an entire body, and to be clear, a non-sentient body, it would not have a functioning brain. Um, that does seem to be weird to people, but I don't really understand what the difference between that and growing a kidney is. And it's actually a lot easier to grow a body than it is to grow a kidney, because the thing about our organs is that they're all designed to support each other. They don't function in isolation. And so growing an entire body, a non-sentient body, with no functioning brain, um, is actually easier than growing into a separate organ. Um, and so it actually makes sense to grow bodies. And if it's not sentient, there's no person or mind that is being harmed in the process any more than there would be if you grew a kidney separately. Like nobody thinks that growing a kidney is an ethical question, right? So why would a body without a functioning brain be any different than just a kidney? It's just a bunch of organs that are designed effectively to support the existence of a brain.
So ideally, it would be grown by your own, using your own cells, right?
Yeah, so
And
ideally
be
you have the
cloned.
foresight to start growing a clone before you need it, and but you can imagine in the future if we gain engineering control of our immune systems, that we could have there wouldn't necessarily need to be a clone, and so you could have sort of off-the-shelf models that are available, and you would just sort of modulate your immune system such that it didn't reject the brain when like you because you'd be getting mostly new bones and mostly new immune system. Yeah, just having engineering control such that the body didn't reject the new brain that it got. But that's foreseeable. I mean, there's a lot of progress right now in engineering immune cells. There's the whole CZI Biohub that's starting up in New York. There's work at UCSF. The number of people working on engineering the immune system is large, and it's a well-funded area. So I imagine that is a problem that we'll solve on the relevant timescales.
But people who are working directly on this replacement strategy, how many are they?
Not a lot. It's maybe like a dozen companies, and similar number of labs that are to some degree or another working directly on this, and then a large ecosystem of what you could call regenerative medicine, um, that is sort of working on the things adjacent to it, that will have relevance, but working directly on the cloning and production of non-sentient bodies. That's a pretty small number of people. Like it's not hard to actually get to know all of them if you work in that area.
So how many would it be about?
Uh, yeah, maybe like a couple dozen. It depends on who you include, but yeah, maybe.
So
I mean, if you had a stronger, like the ones that are specifically doing it for life extension purposes, it might be more like 10.
so basically, one of the two most promising strategies for curing
Has only 10
aging
people working on it.
has 10 people working on it.
Yeah, and the most hard part of it, which is the brain, has well, yeah, I guess if you include, maybe, yeah, I might want to round that up to like 30. Maybe there's 30 people, but yeah, that's not many.
So if there is a flight crash, then that hope is
Yeah,
gone
yeah, because sometimes
for us.
they all go to the same conference, and like just they all get some kind of weird new pandemic happens and they all die. Then that's it. The field doesn't exist anymore.
I hope they have cryo contracts.
Yeah, well, that wouldn't help us though because they won't be revived anytime soon.
Right. Uh, Mark, this idea of the replacement strategy, is this originating with Sean Hebert's book, Replacing Aging, or was this field started sooner than because sometimes it feels to me like he's the central hub of all of this.
Yeah. Well, I think no idea is generated in a vacuum, right? And so I think a lot of the precursors to this idea have existed for a long time. But he was the first one to be very explicit and coherent and comprehensive in presenting the case for this. And his book, Replacing Aging, I think does a good job of that. Um, so yeah, I wouldn't say that he like totally invented the concept, but he was the one that sort of, yeah, made the clear, coherent, comprehensive case for it first. Early experiments in head transplants, body transplants in animals, I think like back to the 70s or even earlier, actually, attempts. But I don't think those were specifically for aging per se. They were just more of a uh, proof of concept or a potential way of helping people that have gotten, into a car accident or multiple organ failure or a rare disease that means that their body is not functioning. So I don't think, yeah, he was the one that really specifically said we could use this for aging also.
So if we're going to do this, we're going to need progressive brain replacement. But can you explain how would that brain actually be attached to the new grown body? How does that even work? What's the concept?
So the nerve reconnection part, you mean?
Yeah.
Yeah, I mean, so we're pretty good at like, reconnect, like when we do surgeries, surgeons can reconnect muscles and um, arteries and veins and those types of things. We have methods for those things that work pretty well. Nerves in the periphery, like people get fingers or even hands severed and they have them reattached. And what happens is that in the peripheral, in the far periphery, often the axons will regrow through the old myelin sheath pathways if you do it close soon enough, quickly enough. And but if you wait too long, scarring happens and atrophy of the sort of supporting cells for the nervous system happens in the periphery, and then you don't get reconnection just automatically. But if you're doing this like in the context of like a surgery, it's very different than like in the context of an injury, right? Like often people think about nerve reconnection in the standpoint of like spinal cord injury, and we've seen how like most people with spinal cords don't recover, right? Like they're permanently paralyzed. Um, uh, but that happens like somebody gets in a mountain biking accident or a car accident, and it could be like 18 hours before they're in surgery, depending on the where and when it happened. And so if you do these uh, cuts and reconnections in a controlled environment where you are able to apply, appropriate gels and growth and healing promoting factors, um, cellular reprogramming factors are one of the ways approaches. There's others. You can get nerves to reconnect actually, and this has been demonstrated by multiple labs. Um, doing the complexity of like doing the vagus nerve and the spine and the full spinal cord, which is a lot of nerves, is high, and it's still, I think, an active area of research. But there's promising. There was like a result in rats from a lab in Belgium where they actually did a spinal cord injury and got and injected neurotrophic factors below the injury site and were able to get nerves to reconnect. So like there's a lot of promising science there. It does seem like it is possible to make those reconnections, but it hasn't been demonstrated in the context of a full head transplant yet. Um, but there's a few people working on
Would
it now.
would if you had the ability to do this, if this intervention was accessible now, what would be the result? Would we see a Mark that looked like he was 20 years young again? What do you see when you think about this
Yeah, from a
with the
superficial,
face and everything?
yeah, because if you're growing if you're growing a non-sentient clone, it does have the other parts of the head, right? And so it's just that it doesn't have a functioning brain, and so you can use all that tissue. And I mean, people have gotten, I think, face transplants now. Again, you still have immunological um, issues with the current regime because it's not based on clones, and we don't have full control of the immune system yet. Um, but yeah, I mean, in its mature form, superficially, you would probably, yeah, you could be like 65, and then all of a sudden you're 20 again from anyone's perspective, because all of the tissue from the outside, um, the brain would be the part, and potentially, like for instance, like the sensory organs, right? The ears and the eyes, like in order to, there's actually an ARPA-H program to do eye transplantation and reconnect the optic nerve. So potentially you could actually have a fresh new eyes and everything, if we get this stuff to work. So it could be the case that in its mature form, yeah, from the outside, you would look completely as if you were 20 again. Um, and then for the brain is the complicated part that we could get into, because obviously you can't just replace the whole brain, then you wouldn't be you anymore. So
Can I ask one question? And it's kind of general as well about this, and that is uh, about the globalization of science. So there's a lot of we might have a lot of bioconservatives balking at this idea, and people who are not used to the idea. But what about in other cultures? If you say Japan or South Korea or Singapore or China, do you think they would be more bioliberal or open to things like this?
I don't know. I think my I mean, one would think that there would be a diversity of opinions if you went to different parts of the world. Um, but I think the same sort of, uh, you could call it the naturalistic fallacy, the belief that things that are the status quo when it comes to nature is better, and that humans doing something to modify it, that does seem to be somewhat universally present, although how pervasive of it is varies, I think. Um, I mean, obviously, nobody alive today wants to go back to not having, well, some do, but most people would not want to go back to a time when we didn't have vaccines or antibiotics, or and there'll be the where now we have things like engineered CAR T cells, which are genetically modified, which we put into people, and I think most people that are treated, that have their cancer cured using those methods, would not want to go back to a time when we didn't have those methods. Um, I think for most people, until there's something tangibly available that actually, like when they know somebody whose disease has been cured or whose condition has been cured because of the technology, it's easy to be reflexively negative about something when it's abstract and doesn't actually exist yet. But as soon as, like, somebody's benefited from it, it's a lot harder to be against it. Um, and people have benefited from transplants, and I still don't understand what the difference between a non-sentient body and an organ is, um, from a sort of logical perspective. And I think this is a conversation, though, to have. Like, we probably should have some kind of meeting where we bring the bioethicists from assorted cultures together and talk about this stuff. Actually, I mean, we should engage with them, which I think would be a very useful project, because this stuff is coming up, and rather than people being caught off guard by it and having a reflexively negative reaction, maybe we should just start talking about it now.
I think that's a wonderful idea. I think that you're completely right. I mean, there is no rational reason to uh, to separate transplants in that way, but there is a reaction from people whenever I tell them. They're like, "What? What are you talking about?" But I'm just going to, because you mentioned Sean Hebert, and of course we will try to have him on the podcast. But I think that people who are listening to this, they probably want to hear something right now about progressive brain replacement and how that would work. So you can just give us a high level overview of how you would do that.
Yeah, well, just like with the non-sentient clones, we know that there are natural examples of people born actually without, due to a genetic defect, their brain doesn't develop. And the people are born that way, and we don't consider them people, and they're taken off life support because they don't have a conscious mind. Although occasionally people keep them on life support because for whatever reason they don't want to, they can't let go, or something, and the bodies develop. But yeah, again, there's no conscious mind. There's also a natural example when it comes to brain replacement, actually. So people often get benign tumors. Well, I don't say often, but there's many documented cases of people that have benign tumors that grow and actually effectively destroy very slowly over time a portion of the brain. But from the outside, these people are fully functional. They don't, like, they could have their entire visual cortex is no longer there, at least where we would normally think of it being present. But because the tumor is growing slowly over time, the functions migrate, and the people have no functional disability. And they only discover they have a tumor because maybe at some point they start to get a headache, and so they go and they get an MRI, and they're like, oh my God, you have no auditory cortex, you have no visual cortex, but you can hear perfectly fine, you can see perfectly fine. And that's because the brain is plastic. So it's able to, as long as it happens gradually, it's able to migrate functions. That includes memories, even. And so we know that this is the case.
That's just mind blowing.
Yeah, well, there's a lot of redundancy. Things are not coded for in just one place, and so and they're kind of encoded in a distributed way. And so, yeah, as long as you're using something, if certain cells are dying, other cells will just take over and fill in the gap, and so the information just gets transferred over time in that way. And so you could imagine, so the brain itself is actually shrinking with age. So space is being made for new tissue that you could just add without actually even needing to do something like a tumor or a benign tumor. But you could also imagine purposefully doing slow silencing of regions of the brain and then replacing them with fresh, young, grown tissue grafts. And the production, design, and transplantation of those grafts obviously takes research and development. But there's proof of concept in mice where they actually have done grafts of cortical tissue, and it's been incorporated and it's shown to function and be made use of. So it's if it works in animals, I mean, it's always possible that it'll be more difficult or slightly different in humans, but usually it's a matter of adapting the protocol. It's not to say that it's impossible. It's just like the exact same protocol might not work in humans, like the same way when like we originally cloned sheep, right? And then the protocol that was used to clone sheep didn't work in like primates immediately. They had to adapt it. They had to come up with some modifications, but eventually they got it to work, and now we can clone primates as well. And the same goes for, yeah, we have proof of concept that you can do gradual replacement for the cortex, at least in animals, and so it probably is adaptable to humans as well. And then, of course, the brain has many other components to it. The brain is a very complex organ with many, or a system, has many different subcomponents and parts. Um, but those, I mean, there's been research projects to create, I think, replacements for a number of them that are in various stages of development. And you can also do cell therapies. For instance, I think 50% of cells in the brain approximately are of the glial lineage. Includes, and those cells are actually mobile, interestingly enough. So you can actually replace all of them through cell therapy and not even have to do a transplant. So 50% of the cells are potentially replaceable without even doing a surgery per se. It's more an injection.
Speaking about surgery, you had Reason on, who's a aging researcher and hosts the very thorough blog Fight Aging. And then you had also Shona Baron,
Mhm.
who we talked about, author of Replacing Aging. And I think Reason said that one of his objections for the replacement strategy is that he doesn't like the idea of doing surgery.
Yeah,
Did I
and
get that right?
that's not a yeah, that he did say that, and I thought it was an interesting comment, and I maybe should have pushed back on it stronger because that's an odd perspective to take, right? Like if your goal is to solve aging, presumably one would want to use the strategies that have the most technical merit, rather than being just, picking your strategy based on emotional reactions, that are like I think he would his name is Reason too, so like it's a little bit ironic actually that he picked his strategy partly based on something that is clearly not rational, a more emotional reaction. But yeah, I think that's probably going to be a common reaction.
I think also, I mean, this is, I've been thinking about what you're doing is like solve aging 2.0. You might hate me for using that term, but you're going a little bit beyond what Aubrey started, right?
Yeah, it's I think he uh, had a really compelling paradigm and narrative around what goes wrong with aging. But yeah, in terms of like the technology development pathways and how we actually fix those problems, he proposed, he proposed a couple solutions, but they, I think, are a bit vague, and they're also like fairly specific. And there's multiple approaches to solving any one. And I think a more I think we think of it as a strategic thing where like this is sort of like a war with like many different battlefronts, and you don't want to just leave certain battlefronts completely unmanned and just pick your favorite seven. You want to actually look at it and say like, well, what are all the possible routes, and are we actually addressing all of them, at least to the best of our understanding. And part of that is sort of a meta level thing of not just what do we want to fix and what can we use right now to fix it, but can we develop new technologies that allow us to make faster progress. So there's like a sort of meta level thinking that I think was, I mean, it's just a much more complicated case to make and story to tell when you introduce those meta levels. Um, but I think it's necessary if we want to like your aging is such a difficult problem that your proposed solution needs to equal it in sort of scale and ambition. Otherwise, you're not likely to succeed.
How has the reaction been to your technical plan to solve aging in the longevity community? Because there are several different kinds of plans, maybe not as thorough as your one, but there is some fragmentation in the community. So how has the response been, you feel?
Yeah, actually, mostly positive. Like I said, when we did the bottlenecks to progress report, we polled the industry, and actually, it turned out they were already mostly aligned with us. They're just not actually saying it. And I think there's a lot of, again, humans are social creatures that feel pressure to conform with social norms. They feel very uncomfortable saying something that goes against social norms, and they're often paid to do things, or even their employer might be not look kindly on them saying certain things, right? And so what people actually think versus what they say is unfortunately heavily skewed by this, like at least perceived set of social norms. But it's kind of funny because if they all actually think this, but they're not saying it, um, maybe there isn't actually a problem in them saying it. Like they maybe the perception, maybe the culture has shifted more than they think, and it's actually more acceptable to say these things because we actually haven't gotten a lot of pushback on it. Although we're speaking mostly to people in the industry, and so we're not. I haven't talked about, I haven't gone on Fox News or anything to talk to Tucker Carlson. so, but but
As certain
at least
others have.
amongst the sort of people in the field, haven't really gotten a lot of pushback. I've had people explicitly say that the only reason why they don't say these things is because they think it's too far outside of social norms, but that they actually agree with me.
Hmm. Are you more optimistic now than you were 20 years ago about our chances of solving this?
Uh, Not really. I guess I would say that I think we're on a better trajectory now than 20 years ago, in terms of like some of the work that I think is important is starting to get more traction and interest. But 20 years went by. It took a long time to get there, and that's 20 years less lifespan that I have. So like the my remaining lifespan has gotten shorter. So even though we're in a better place than we are now, we've gone from having zero like regulatory approved aging interventions to zero regulatory approved aging interventions. And while it's um, I think you have to maybe have a little bit of naive optimism in order to have hope on something as uh, difficult as solving aging. But yeah, like it's hard to like look at a line that's 0 to 0 and then like project it all of a sudden. It's just gonna go shoot up all of a sudden, right? Like we don't. Yeah, it's not clear to me that we're the rate. It's like we need to make progress faster, but the rate of acceleration may still be too slow. And I suspect that it currently still is for at least most people alive today from benefit. Maybe somebody born today has a very high probability of living to see these technologies mature, but at the current rate of progress, I think most living humans will not live to see that, and I think that's really unfortunate. We, I think I at least think it would be it's morally imperative to try to solve these things faster, so that more people could benefit.
Hmm. Have you thought about preserving yourself with cryopreservation?
Yeah, yeah. So like I said, all right, we mentioned earlier that tomorrow Biostasis is opening operations in the United States. So I'm gonna look into signing up for that. Um, at my age and with my lifestyle, I think the most likely case of me dying is actually, having an accident when I'm rock climbing and being, smashing my head in like a watermelon on a cement, falling off of a cliff, and probably nothing recoverable. Um, but
That's the most Mark Hamalainen answer I've heard, I think.
yeah, it's just that I mean, my chances of dying of like a disease or aging right now are very low, right? So I don't think that like yeah, the I most likely would die of something that would be a situation where there's nothing to store cryogenically, nothing worth saving. Um, so I don't know if it's the value proposition is low, but of course, I mean, you can fund a cryonics contract with life insurance, which isn't terribly expensive, and so especially when you're younger because you're not likely to die, and so I think it's a good. There are scenarios where you might end up in a situation where you could benefit from it. But so I am going to look into it. I'm not currently signed up, but I probably will do that at some point in the near future. It's definitely a plan B, though. I would prefer to avoid having to do that, um, especially since, at least with existing technology, it's definitely not clear that um, the that you would be recoverable, because the ice formation that happens during rewarming, I think, would damage your brain to the degree that yeah, you wouldn't be recoverable. It's not currently a reversible process. And so the biostasis roadmap is how do we get to full reversibility? And I think once we've demonstrated full reversibility of cryostasis in an animal, I expect that there'll be quite a flood of interest in cryopreservation at that point. We've done it for rat kidney, but I think it'll be a full animal, like a full size rat. Freeze it, thaw it. It's fine. That's the thing that'll change people, get more interest in this.
I thought earlier you said that biostasis can be cryostasis, but it can also be some other way.
Yeah, there are other so there's like sort of hibernation states and things like that that you can imagine. The downside to those are they don't actually stop aging, they just slow it down. And so um, it doesn't buy you a large amount of time. Um, the idea with cryostasis is that if you're not going to otherwise survive to see a solution to aging that's like sort of on the bioengineering pathway or replacement pathway, um, that you could cryopreserve yourself and be revived when that technology does exist. So it's just like a long sleep that you take, and then you wake up and when the technology exists. But with the other approaches to biostasis, at least the sort of hibernation or torpor-like states, those you would still be aging just at a slower rate, and so you're losing out on subjective time and subjective experience that you could be having. So it might not, I don't know, that's maybe not a great trade-off or not an ideal trade-off to make. There is another concept which is brain plasticization and uploading. Personally, well, we do or we will reference it in the roadmap. It's not. This is comes down to, I think, subjective preferences. For me, the idea of having using a plasticized version of my brain, scanning it, and then creating a replica, some sort of simulated replica, and being another substrate, a computational substrate. Um, my interpretation of that is that your dead brain was used to make a copy, a functional copy of you, but you still died. So it doesn't really appeal to me because I care about this instance of me, about my ongoing continued experience. And so just making a copy of me, like you could imagine some advanced brain scanning technology that could scan my brain right now and then make a copy of me in a computer. That wouldn't change the fact that I don't want to die. And so like having a copy of me created doesn't solve the problem that I want to solve, which is my continued experience.
Mm.
That's my intuition as well. Peter?
Yeah, I think that the interesting thing of many interesting things about Mark is that you are quite apart from many others in the field, um, really honest about this when you're talking about the chances that we're going to solve this in our lifetime. But I think that when I was at the retreat, there was also this feeling of optimism that there
Mm-hmm.
was a whole community of people that wanted to do something together to get to work on this together. And I think that's your call to action. Like, you shouldn't just sit on your rest on your laurels here, that you have to do something if we're going to solve this and fix this.
Yeah, I mean that's my basic view is that this is a solvable problem. It's a question of if and not, or it's not a question of if, it's a question of when. And so the more people actually get engaged on working on this, the greater our chances of success, the sooner. And so yeah, that's my motivation for running the LBF is to change that small chance of success to a much larger chance of success by getting a lot more people excited about this and working on it. And yeah, and the key, like you mentioned, is the LBF is very much a bias to action. It's like don't just optimize your diet and your exercise routine and hope for somebody else to solve the problem for you. Actually get into the field and get to work, because that's what we need is actually people working on this, um, and advocacy and doing what you like. We have a podcast, you guys have a podcast. I think a big problem is that a lot of people in the world just don't even know about these technology pathways and how promising they
Definitely.
are and what are the different
Mm.
possible things that they could be working on and how they could contribute. And so just making sure that everybody who would be interested in working on this knows that it's an option, I think is very important. So I think yeah, getting the word out and just making sure it's in the public conversation, I think, is very important.
If what's next for the LBF? And I think we're going to air this in mid-August or something like that, so you could take that into account. But what's next for LBF, and how can people reach out to you if they want to get in contact and want to do something about it?
Sure, yeah. We have a conference coming up at Stanford this coming weekend, so that'll be after the podcast airs. It's a joint conference run by us and the Foresight Institute called the Longevity Frontiers Workshop. Um, and then we have our next cohort, LBF5, will be August. The kickoff retreat will be August 21st to 25th in California. So that might be after this airs. But then the next cohort, we don't have a date yet, and there's multiple possible options. And then, yeah, you can also follow our podcast. Me and my co-founder Nathan have a podcast, the Longevity Acceleration Podcast. If you like the work that we do and you want to support the development of the roadmap and the podcast and the Longevity Biotech Fellowship, I should say that it's a volunteer-run organization, and we take donations. We're a 501c3 nonprofit, and that just goes to cover the operations and so we do need the support of members and donors in order to do the work that we do. And yeah, and you can reach me directly at mark@longbiofellowship.org.
Yeah, Mark, thank you so much. You're doing awesome work,